Hello, everyone. Today, let's discuss the differential diagnosis of diabetes mellitus with a focus on key clinical features and specific etiological clues that we start with type 1 diabetes mellitus, or T1DM. This typically presents in young individuals, usually under 30 years of age. The onset is rapid, with symptoms like polyuria, polydipsia, weight loss, and sometimes diabetic ketoacidosis, or DKA. Etiologically, it results from autoimmune destruction of beta cells. Patients will often have positive islet autoantibodies such as GED, IA2, or ZNT8, and low or absent C-peptide levels. Next, we have type 2 diabetes mellitus, or T2DM. This usually develops in middle-aged or elderly individuals and progresses gradually. Patients are often overweight or obese, and a strong family history is common. They may initially be asymptomatic. The underlying mechanism is insulin resistance with relative insulin deficiency. Unlike type 1, C-peptide levels are usually normal or elevated, and autoantibodies are absent. Now, let's move to maturity-onset diabetes of the young, or MODY. MODY typically presents before 25 years of age. Patients are non-obese and have a strong autosomal dominant family history. Fasting hyperglycemia is often mild, and ketosis is not a feature. The etiology is a monogenic defect in beta cell function, commonly due to mutations in HNF1A, HNF4A, or GCK genes. Another important entity is latent autoimmune diabetes in adults, or LADA. This form presents after the age of 30. Initially, patients do not require insulin but progress rapidly to insulin dependency. They usually have a lean body habitus. Etiologically, LADA shares features with type 1 diabetes, especially the presence of anti-GD antibodies. Moving on to secondary diabetes. This type arises due to identifiable causes like a history of pancreatitis, pancreatic surgery, hemochromatosis, or endocrine disorders like Cushing's syndrome or acromegaly. Chronic steroid or antipsychotic drug use can also lead to secondary diabetes. Here, the clinical context provides important diagnostic clues. Finally, we discuss gestational diabetes mellitus, or GDM. This is diagnosed during pregnancy and is often asymptomatic. Key risk factors include obesity, polycystic ovarian syndrome, and a family history of diabetes. The primary cause is placental hormone-induced insulin resistance. Women with GDM have an increased risk of developing type 2 diabetes in the future. In summary, understanding these clinical features and etiological clues is essential for accurate diagnosis and individualized management of diabetes. Thank you for watching.